Bipolar disorder is a mental illness that involves both having had an experience of a manic episode as well as experiencing depressive episodes.
So the main types really are bipolar 1 and bipolar 2. Bipolar 1 means you have true manic episodes. So when you have mania, you have these psychotic symptoms. Bipolar 2 means you have the depression alternating with hypomania. You never become actually manic, you never have psychotic symptoms, you only alternate to hypomania. Hypomania is expansive mood. You feel sort of special, fantastic, or highly irritable. You might spend more money than is appropriate or you have. Something called hypersexualized, so you have a higher sex drive. You might even act out sexually more than you normally would. You have flight of ideas, so thoughts are coming very quickly, and you might even be speaking very quickly. So this sort of sped up state that's a little higher than a kite, that does not include any sort of psychotic symptom or break with reality. So nothing that is a hallucination of any sort, nothing that you hear things that aren't there or see things that aren't there or have thoughts that really are completely irrational. If you do have one of those thoughts, I'm talking to God, the Martians are in the television, something that is really a delusion, a break with reality, or you hear things or see things, that is psychosis.
So the difference between bipolar 1 disorder and bipolar 2 disorder really is a matter of magnitude. And the way you can usually tell the difference is, in the first one, in a bipolar 1, it really has to do with the consequences of the behavior. If the person's getting into trouble, a lot of times you see people with bipolar 1 disorder because they've gotten in trouble with the law or because they're having some problem related to gambling or spending or sex or these other activities that get them into sort of the legal system.
The problem with bipolar disorder, as is the case with many of these mental health issues, is that one's judgment may really be impaired even in the earlier stages of illness. So it's often the case that people who are suffering don't recognize it in themselves. And it usually is the people around them who see what's going on. In fact, people in hypomania may be feeling really pretty good. I don't want to go in for treatment. I feel great. I don't know what you're talking about. So it really is incumbent upon others to note in family members or in friends something is going on and to help them to seek treatment.
If you're having thoughts of suicide, get support. Call the Suicide in Crisis Lifeline at 988.